Next, we're moving on to active range of motion and passive range of motion, starting out with hip flexion. The range should be roughly 110 degrees to 120 degrees of flexion. Starting out, you'd want the patient to actively flex the non-symptomatic side. So for the sake of this video, we'll only be demonstrating one side, but in an actual examination, you'd want to do both and compare the two. So let's say that Lindsay's suffering from right hip pain. We'll start on the left here. So Lindsay, flex that left hip. There you go. At the end range here, I'm going to apply some overpressure, passively moving it further into flexion. Good. Yeah, and back. So if pain were generated during this movement, we'd have to think of the primary muscles involved. The primary hip flexors would be the iliopsoas, rectus femoris, and sartorius muscles. Pain here could be indicative of a hip flexor tendinopathy, perhaps osteoarthritis, or some type of femoroacetabular impingement. So while performing these, run through that differential diagnosis in your mind. Now let's look at internal and external hip rotation. So Lindsay, first off, we're going to bring the knee into about 90 degrees of flexion and the hip into 90 degrees of flexion. And I want you to create an internal rotation. So your foot will be moving outwards this way. Okay, so go for it there. Great, and I'm going to apply some overpressure here. So any pain or resistance here that might elicit symptoms, we'd be thinking of osteoarthritis of the joint. Now coming back to neutral here, and that would be roughly a range of 30 to 40 degrees of internal rotation would be normal. Now let's go the other way, external rotation. Okay, now I'm going to apply some overpressure again. So here we're looking at about 40 to 60 degrees of external rotation would be normal. And once again, if there's any pain elicited or symptoms elicited, once again, we'd be thinking osteoarthritis or some type of degeneration of the hip. Now, while we're here and Lindsay's in the supine position, this is the position where we can do some hip circumduction. And now what that is bringing that hip into the extreme ranges here. So we're going to come do some hip rotation this way. We're going to bring it back and all the way through. So as you can see, we're getting into those end ranges of hip movement. Now, any discomfort in that position could possibly be suggestive of a labral tear. Now let's look at abduction and adduction. So abduction and adduction of the hip. Starting out with abduction, I want you to move your leg as far out as you can towards me this way, keeping it in the, oh, let's start again. So don't bring it up into flexion, but try to keep it in this plane of movement. Okay, so let's come out this way. Perfect. So normal ranges would be about 30 to 50 degrees. As we can see, Lindsay's a lot more flexible than that. At end range, we're going to stabilize the opposite ASIS, and we're going to bring this further into abduction. Yeah, you're almost at 90 degrees there, so it's pretty impressive. Now, we're going to go back, and now we're going to do adduction, so adduction. On this one, you want to bring your leg that way. So I'm going to raise this one to get out of the way and bring your leg across. Normal range here would be about 30 degrees. And once again, you're quite flexible, so we're going to bend your knee here. I'm going to stabilize the outside of the leg here, and I'm going to push it further into adduction. Okay, good. Okay, and go back to neutral here and relax. And lastly, we'll examine the active range of motion and passive range of motion of hip extension. So patient is prone. Something that you should consider and that we do in clinic is stabilizing the lumbar spine. You want to make the movement as purely a hip movement as you can without any compensation further up the chain. So Lindsay, you're going to keep the leg straight, and I want you to raise that right leg into extension, hip extension, good. And then I'm going to take it into a little bit further extension. Perfect. Good. Okay. And once again, always compare both sides.